We're going to talk about the skeletal anatomy relevant to the intra-articular injection of the ankle or ankle joint proper, or it's also called as talocrural joint or tibio-talar joint. So it's the inferior aspect of the tibia and the talus, and this will be your target. To perform this procedure, the ultrasound probe needs to be placed longitudinally on the tibia, moving down, looking for the inferior edge of the tibia and the talar dome, and performing this injection. You can perform it out of plane, placing the needle out of plane. Soft tissue structures which are important to look for is the tibialis anterior tendon and also the extensor hallucis longus tendon and the artery which is the dorsalis pedis artery. You want to avoid these structures, so you can perform an out of plane technique getting into the joint under ultrasound guidance. So I'm going to talk to you about the intra-articular injection of the ankle joint or the ankle joint proper or tibio-talar joint. In order to perform this procedure, you will use a high-frequency linear ultrasound probe. You can start to scan the tibial shaft, move distally. As soon as you see the tibial shaft becoming the undersurface of the tibia, you will start to see the talar dome coming into your view along with the articular cartilage. You do have a vascular structure and a tendon which is a tibialis anterior tendon. You want to make sure that the tendon disappears so that you don't go through the tendon. This will be a good image to go out of plane, avoiding the vascular structure and getting into the joint. When you move laterally, you will get another structure that's coming into the view. That will be your extensor hallucis longus tendon. So you really want to avoid the tendons when you're performing the intra-articular injection. The other view to perform this injection would be the transverse view, where you can look at the joint and you will basically be able to get into the joint. As you could see, the talar dome along with the flexus of the ankle, and you will basically be able to extensor of the ankle, and you will be able to get in from the lateral aspect into the joint capsule. So these are all the extensor tendons of the ankle joint. Along with that, you will be able to see the pulsations and the veins. So vascular structures, keep in mind the arterial pulsation you will see here is the dorsalis pedis artery, and you want to avoid injecting or injuring the artery. So go down, look for the ankle joint proper and enter it from lateral to medial, and you will be able to inject about 4 cc's of local anesthetic and steroid mixture.